Good morning, Chris Fawcett from the Headache and Pain Management Centre here for our weekly Tuesday check-in and catch-up. Today we'll be talking a little bit about codeine, and it's not really about physios talking about drugs or anything like that generally, but considering such a large number of patients that we see do take a lot of codeine to manage their pain. Basically, I thought it would be a good idea to let you know about the changes that are afoot that are coming thanks to the government. So what it looks like for next year is that due to regulations and a lot of the opioid crisis that's been happening, not so much in Australia, but you can certainly see what's happening in America, where a lot of people are getting addicted to opioid medication, and there have been a lot of sicknesses, illnesses, addictions and deaths from it. The Australian government, in their wisdom, has decided that codeine is to be prescription only as of February next year. So what that means for you, effectively, is that any time that you'd like to see your pharmacist and get any of the medications that you're after, so I'm talking things like Panadeine Forte, Nurofen Plus, anything with codeine in it. Sometimes even it talks about the cold and flu tablets that have the phenylephrine and some codeine in it as well. All of those appear to be prescription only. So what it means is that if you do need codeine, you can't just go to the chemist and buy it over the counter. It means you need to go to your doctor, get a referral, get a prescription to the chemist, and then get codeine, which means that there's a lot of time wasted, a lot of resources wasted. It means you need to see the doctor more to get the pain treatment that you need. Of course, there's another way to do it, and that is to see what is causing your pain in the first place. So when we talk about codeine, basically it's like a very strong band-aid. So it's very good for acute pain. So if you've got a fresh surgery, a fresh injury, if something has occurred where you need that quick pain relief. But when it comes to chronic pain, when it comes to pain that's there for more than 2 or 3 months, where the tissue damage isn't really such an issue anymore, but it's more a pain issue, a chronic pain issue, codeine is not really the thing to take long term, because what they've been showing in the research recently is that codeine itself can sensitise your nervous system more and make you more prone to having headaches and pain. So when we're talking about, g'day Aaron, nice to see you there, buddy. When we're talking about headaches and pain, we know that a lot of people take codeine for that relief short term, but the last thing you want is to be addicted. And of course, if you need to go to your doctor to get a prescription every time you need to get codeine, what it means is that you need to waste more time going to the doctors. You're not actually finding out what the cause of the pain is, and you need to find another way to do it because it becomes far more inconvenient. So the way in which you find out is basically to get a very good assessment from a health professional who knows about pain. That might be a physiotherapist, that might be it might be your pain specialist, it might be your GP, and looking for other options to see what it is you can do to get that pain under control without the codeine, because it is going to be a lot more difficult to get access to it come New Year. Thanks for the question. I can't remember the name of the person who emailed me yesterday to ask that question, but thank you for that. And I'm sure that a lot of people have got out of the video that codeine is going on prescription only next year in February, and basically you need to take action and steps to get your pain under control, which doesn't involve codeine as the answer. As always, like, comment, share below. We'll be having another video just before Christmas, just to wish you a Merry Christmas and New Year. And hello to everyone who has liked our page in the last little while. It's good to talk to you again, and I hope you have a wonderful day. Thanks very much. Bye-bye.